Moulana Hospital, the synonym of healthcare in Perindalmanna, the multi-speciality super speciality hospital which stands tall among its counterparts in Perindalmanna, the land fondly referred to as the medical hub of Kerala. Right from the time of its inception in 1990, Moulana Hospital Perindalmanna has set new benchmarks in the quality of medical care as well as the sanctity of medical ethics. Each and every specialty, super specialty departments of Moulana Hospital is par international standards. The increasing patient turnover and treatment success rates bear testimony to the ascending graph of its glory.
Moulana Hospital, a super specialty hospital, started in 1990, providing excellent health care to the people of Kerala, other parts of India and even Middle East at an affordable cost. General surgery and laparoscopic surgery department is one of the excellent departments of our hospital. The laparoscopic surgery started in 1993 and weight loss surgery started in 2006. Moulana Hospital is always eager to update the technology, providing quality health care at an affordable price to the people.
Like a feather in its cap stands out a department proclaiming the contribution of Moulana Hospital to the medical fraternity, Moulana Hospital, Department of General Surgery, GI Endosurgery, Bariatric and Metabolic Surgery. A team of expert surgeons headed by Dr.Mohamed Ismail, a wizard in the field of laparoscopic surgery in India and a top-ranked bariatric metabolic surgeon of international acclaim, has crossed milestones after milestones to set records in this continent.
The General Surgery Department has been functioning right from the inception of Moulana Hospital in 1990. The advent of laparoscopic surgery during 1990 by Philip Morey has ignited an explosive period of growth in the gastrointestinal field. This newly formed surgical technique was popularized in India during 1992. We could start the laparoscopic surgery department in Moulana Hospital during 1993, and during the last 18 years we could do, including both basic and advanced laparoscopic surgeries, almost more than 60,000 cases. That is one of the largest series in Asia.
It was he who introduced latest surgical advancements to this part of the world and familiarized laparoscopic surgery to Kerala in the early 90s when the same was in infancy the world over. Till date, he holds the rare distinction of conducting more than 60,000 laparoscopic surgeries, and Moulana Hospital became the first ever center in Kerala to start laparoscopic oncosurgery. Also, the institution holds the record of conducting more than 3,000 stapler hemorrhoidectomies, the largest number in the country. More than 6,500 endoscopic hernia repairs, more than 3,000 varicose vein surgeries, one of the few centers in India performing bariatric and metabolic surgery, of which the only institution in the country to perform more than 300 bariatric and 30 metabolic surgeries, and more than 1,000 thyroidectomies are all laurels amassed by this team headed by Dr. Mohamed Ismail, and his surgery department has emerged as the center of excellence in all kinds of minimally invasive surgical procedures. A visionary, Dr. Mohamed Ismail has always moved ahead of times. In the modern era, where conventional surgery is giving way to laparoscopic surgery, the name of Dr. Mohamed Ismail will be recorded in the annals of Kerala medical history as a father figure of this surgical technique. Now, with the same zeal, he has channeled his dexterity and expertise to new avenues of surgery: bariatric surgery, the permanent surgical cure for obesity, and metabolic surgery, the surgical cure for diabetes. Even before we Keralites are getting informed about such procedures, Dr. Mohamed Ismail has become the ambassador of these immense surgical possibilities.
As you all know, the morbid obesity it is a global epidemic and which kills almost one patient in every 10 seconds. The list of comorbidities which is caused by the obesity is day by day it is increasing. It is from the diabetes mellitus, hypertension, cardiac disease, arthritis, sleep apnea to even the cervical cancer. The morbid obesity is one of the reasons. And the surgical treatment of the morbid obesity is bariatric surgery, which is one of the most common surgical procedure being done in USA and other Western countries. In India also the procedure, this bariatric surgery has started during 2003, and in Moulana Hospital we could start this laparoscopic bariatric and metabolic surgery during 2006.
Diabetes and obesity, the two main health challenges faced by mankind, are like two sides of a coin. These chronic health conditions, which takes its toll on both the physical and mental domains of the affected, are a burden not only to the individual and family but to the nation as a whole. Especially the psychological trauma faced by the morbidly obese is immense. And here comes modern medicine to the rescue. By this time-tested surgical procedure called bariatric surgery, obesity can be cured once and for all. This laparoscopic surgery gives long-standing results and recovery from related diseases. Its safety and efficacy are emphatically proven world over. Bariatric surgery is indeed a rebirth for a morbidly obese person in all his physical, social, and psychological domains. In the hearts of hundreds of cured persons, Dr.Mohamed Ismail is a god in surgeon's attire, and their beaming faces of gratitude are his driving force. Bariatric surgery is considered universally as the safest and sure remedy for obesity. 3 surgical procedures, namely lap banding, sleeve gastrectomy, and gastric bypass, are mainly employed. The volume of stomach is generally increased in the obese. This leads to overeating, followed by further increase in body weight. This is a vicious cycle. Through bariatric surgery, the size of the stomach is made smaller and the stomach capacity is reduced.
As you all know, the diabetes is another alarming disease. It is just like that HIV during 1980. In 2010 or 21st century, the diabetes is one of the killing disease. It affects all our other organs like the kidney, eyes, the nerves, heart, and everything. And the WHO has put the diabetes and the heart disease as a dangerous pair. And almost 80% of the diabetes patient is some or the other time they are going to get a heart disease. We all thought that once a patient becomes diabetic, he is going to be diabetic lifelong. But now with the advent of the bariatric surgery and the observation we noticed during the bariatric surgery that the diabetes obese patients, after the bariatric surgery, their weight is getting reduced. Not only that, their diabetes is also getting cured. So this observation has ignited a lot of research, and now we found that there are a lot of hormones which is secreting from the gastrointestinal tract, almost 100 hormones, and gastrointestinal tract is one of the largest endocrine organ in our body. And this, if you rearrange the gastrointestinal tract so that we can increase a certain hormone level like incretins and decrease some hormonal levels like anti-incretins, that will favorably affect the pancreas, that is the insulin secretion, the insulin resistance, and the beta cell activity, so that you can cure the diabetes. Even though it is not FDA approved and all these surgeries are under clinical trial, in India there are 5 centers which is recognized by the ICMR for this diabetes surgery, and Moulana Hospital is one of it.
The astonishing development that diabetes can be cured surgically is based on the latest landmark discovery in medical science. The metabolic surgery is an offspring of the new finding that stomach and intestines also play a role in controlling diabetes along with the pancreas. This latest development, the metabolic surgery, recently approved in the developed countries through the pioneering works of Dr. Mohamed Ismail, is now available in India and Kerala too. Different surgical techniques are employed in metabolic surgery, namely laparoscopic duodenojejunal bypass, laparoscopic standard ileal interposition, laparoscopic diverted ileal interposition with sleeve gastrectomy. Though metabolic surgery is not the wonder remedy for all diabetes, it is definitely a ray of hope for a country like India, known as the diabetes capital of the world, where thrives crores of diabetics. The outcome of 100+ metabolic surgeries for type 2 diabetes conducted across India in 4 centers including Moulana Hospital is promising. This includes even non-obese patients with less than 30 BMI. All these patients could either stop or reduce their insulin and medication use.
Hi, my name is Sajeev and I am based in Dubai. See, to tell you very frankly, one of the best decisions I have ever taken in my life is undergoing this diabetes surgery with Dr. Ismail. Why I have to tell you this is because it was in 2009, mid of 2009, where I had to undergo a small surgery. It was at the time I was diagnosed with diabetes, which is hereditary in our family. And at the time I was 38 years old, and it was very, very depressing for me. It was at the time I came to know about Dr. Ismail and his team in Moulana Hospital, Moulana. So I came down from Dubai where I am working. I had taken a prior appointment with him. I had a 10 minutes consultation with him. It was at the time he told me about this surgery, about this new development which is happening in the Western world. That's a small, simple surgery which is like a permanent cure for diabetes. In that 10 minutes, knowingly or unknowingly, there was a bond or a trust which was developing between me and my doctor. See, today he is no more a doctor to me, he is a very best friend to me also. See, the amount of confidence which the team of doctors gave in me made that process of going through the surgery very simple to me. And the angels who had really taken care of me after the operation, it was remarkable. So there's no words to explain what they really mean to me.
Many patients, both within the country and abroad, attend the OPD of Moulana Surgery Department daily, seeking permanent solution for their morbid obesity and uncontrolled diabetes. The fully equipped department receives you with a welcoming smile. Detailed consultations and investigations are conducted systematically in the chronological order and posted for surgery. Here blooms a strong and friendly relationship between the patient, his family, and the consultants. The results of bariatric and metabolic surgeries are not just a one-day feat by a single surgeon. Instead, it is the success of a team effort. A team comprising of the surgeon, anesthesiologist, endocrinologist, physician, nutritionist, psychologist, physiatrist, and nurse. The team headed by internationally renowned Dr. Mohamed Ismail put their heads together and go on with the surgery on a well-drawn plan of action. Moulana Hospital is privileged of having the most modern operation theatre complex in Kerala, with infrastructure and equipments of international standards. Anesthesiologists, specially skilled in bariatric and metabolic surgery, are a boon to this team.
We have a specialized anesthesia care for bariatric patients, and they must have utmost care during the preoperative period, intraoperative period, as well as the postoperative period. So intraoperative period, the requirements are they require a ideal OT table. Actually, that should bear the weight of more than up to 200 kilograms. And then most of these patients are likely to develop DVT, that will be deep vein thrombosis, post-operatively. So in order to prevent that, we have got a DVT machine for preventing deep vein thrombosis. Then regarding anesthesia, Actually, utmost care is required during induction of anesthesia, maintenance of anesthesia, and emergence of anesthesia. And we have a good anesthesia team for doing bariatric surgery.
The person undergoing surgery by the most skilled hands in India is shifted to the post-operative ICU without any complications. Here, he receives the utmost nursing care 24/7. Within days, he is shifted to the ward and is under the caring service of the crew until discharge. Post-discharge too, the person will be under the watchful follow-up of the team, for strict diet and exercise regimen has to be followed. By these meticulous processes, the morbidly obese and the uncontrolled diabetic walks into a new dawn of life. Even when all the facilities are made available at an affordable cost, Moulana Hospital is equipped with quality deluxe and suite rooms of star hotel standards for the affluent and foreigners.
We could provide these high quality surgical work in very affordable cost also. There are a lot of very patient friendly packages available for these high quality work and highly advanced laparoscopic procedures. This is with the help of, definitely with the help of the management of Moulana Hospital. They are very keen to offer the high quality work to the public with a very affordable cost.
Scientific advancements have made a tremendous impact in the medical field. Those procedures once considered fiction are now a scientific reality. And bariatric and metabolic surgeries are ideal examples. These advancements, which were only meant for the rich in the developed countries, are at an arm's reach even to a layman in a remote village in Kerala. These happenings are an outcome of a unique companionship of an effective, far-sighted management and a team of gifted, committed doctors. And this is precisely what is happening at Moulana Hospital. Thousands of patients depart with a smile of gratitude, and old records give way to new ones frequently. All happens in Moulana Hospital only because of this unique combination of quality, compassion, and character. Moulana Hospital, Department of General Surgery, GI Endosurgery, Bariatric and Metabolic Surgery. Moulana Hospital, Ooty Road, Perindalmanna. Phone 04933 300600 228511. Website moulanahospital.com, obesitycureindia.com. Email mdismail13@gmail.com.